thank you for coming on this podcast, Milad. Before I speak to you about your journey, I wanted to get the listeners to get to know you better. So, a brief background about yourself.
Hi, thank you for having me. It's great to be here.
Great to have you on.
Just a bit about myself. I'm a medically trained doctor in my final year training as a GP. I qualified back in 2011, so actually I've been doing this for quite a while. I did have a 2.5 year gap when I was not well, so I stepped out from my career, but I'm back now. I've been back for about a year. Well,
Alhamdulillah, that you're well and back. Some people might know you from reading your blog, Listen to Your Body. Let's start by asking you about your journey, and I'll let you tell your own story.
So without wanting to completely bore the listeners, because obviously my journey is one that I've kind of documented in quite a bit of detail, if I had to say anything, I'd say it was an unexpected one. I'd had my symptoms. So for those who don't know, I was diagnosed with lymphoma in 2016. I was working then in hospital as in the specific speciality I was working in was in obstetrics and gynecology. And at that time, it was something very, very unexpected in some way. I had been unwell for quite a while. Just going back, I remember the first time I felt quite unwell was after I'd seen a young girl who'd fallen pregnant, and I remember I spent quite time with her because we wanted to make sure there was no safeguarding issues with her pregnancy. So I remember her being unwell, and then I thought I just caught a viral illness off her, and that was the beginning of me kind of being unwell. I had fevers which were quite high, constantly above 38, and I kept putting it down to me being on call, working long hours, and just
stress.
And I'm the type of person who I never call in sick from work. Unless someone's probably chopped my leg off and I can't get into work, I will always be at work. I was always very dedicated to being at work very early, trying to be the first one in at work. So despite being ill, I kept just taking some pain relief and just kept going into work. Gradually, I began to drop weight slowly, and then I kept putting that down to being just stress. Then I started developing itching, really severe itching all over my body. And I'd constantly be scratching. Everyone would look at me as if I've got like rabies or something, because I was constantly just scratching myself. And so I had these symptoms for about over 2 months or so, and they were getting gradually worse. Part of me suspected, part of me knew I wasn't well. And so I decided to do a bit of my own investigation, and I decided to do my own blood tests.
Okay.
And they came back, there were some abnormalities in my blood tests, but again, I kind of found reasons to try and explain them. I was really good at trying to cover up and trying to find my own kind of reasons. Sorry, I know I'm probably going on quite a bit.
Please. So
then eventually I was on call one night. I was doing a night shift, and I was wearing scrubs, which is the clothes that surgeons wear. Yeah. It's what we wear because I was doing obstetrics and gynecology, so we used to have to do some cesarean sections. I'd be assisting, obviously I wouldn't be doing it myself. So I was in scrubs, and I had to keep changing my scrubs because I was sweating so much, and it just looked like I'd just run a marathon. The scrubs were completely stuck to me, and I just felt so uncomfortable. And then I sat down on the desk just to write up a patient's notes, and next to me was a medical registrar, the medical registrar who was on call. And he obviously saw I was in quite some distress, and I just turned to him and we had a bit of a chat, and I said, these are my symptoms. And he said, well, you look really unwell, and you look like you shouldn't even be at work. And then I said to him, no, we're very busy. I have to carry on with this night shift. And then he told me, well, will you promise me one thing, that you won't leave work tonight without coming back and finding me, because I think let's just get one of the consultants to just have a look at you. And I said, don't worry, I had coincidentally booked a GP's appointment for the next morning.
Okay.
So I told him, but I've booked a GP appointment. And he said, no, I don't want you to leave the hospital building. at the end of your night shift. So I stuck to my word. He took my number, so I kind of felt like I had to commit to his word. And then I was seen. I had some blood tests, and they said, "Oh, let's just do a chest X-ray, routine blood tests, routine tests." And I think because I'm medical, us medics, we tend to want to over-investigate our colleagues. I think it's so. They did a chest X-ray, and that's. And I was waiting to go home. And then a doctor came in, a respiratory physician, so someone who deals with lungs, came in and just pulled the curtains round. And that's when I first knew something was not right, because for a doctor to pull the curtains round a cubicle and just the look he had on his face, I knew this is more than just, say, a chest infection or more than just a viral illness, because he seemed quite serious. And that's when he sat down and said, "We found something on your chest X-ray. It's showing some shadows." And he said, "We think we need to get a CT scan done urgently. You can't go home." And within about 15 minutes to half an hour, I was put through a scanner. I had a full body CT scan, and that's when I was told that they're suspecting it's cancer. And that was it, really. That was it. I never went back to work at the end of that night shift. Within a week, I'd had my operation to remove a lymph node, and my diagnosis was confirmed. So that was how it all happened. So it was a shock. It must have been.
It must have been. But well, I want to ask you about. I mean, not to put you through that memory again, but how did it feel after the CT scan to hear that we suspect it's cancer at your age, with starting a new life, a new career, and then you get told that? What's the first thing? And again, I'm sorry that I'm asking you this, but what's the first thing that comes to your mind?
I went into fight and flight mode. My automatic reaction was, "It's okay. I'm going to beat this." And I was like, "It's okay." And I remember I was alone, and I remember the consultant and the registrar turning to me and saying, "Would you like us to get someone? You're here. How are you going to get home?" And I remember, and I said, "Don't worry, I'm okay. I'm going to get through this. I'm going to be okay." And I think they thought then that it was me I was trying to protect myself. But I knew I was going to be okay. I knew I was going to get over it. So I had this power just from within that came, and I was like, "It's okay. It's just a problem. I'm going to face it, and I'm going to get through it." And I did. And
you did.
And I think it's having that willpower, because I was there time and time again telling my patients, things hopefully will be okay. And so I had to say that to myself, and I did.
Alhamdulillah, you did. How was the support from your friends and family? And it's bad enough that you hearing the news, but then telling your family.
Yeah, it was difficult, and I think I knew I was going to be okay, and I knew I would handle it so well. And I've always had a high pain threshold, and generally I knew I could handle things quite well. So my biggest worry was actually my family and their reaction, because I didn't want them to be upset, because my father back in 2013 was involved in a road traffic collision, and he was really poorly, so we were in hospital with him for a long time, and I was just worried about putting my family through that. That was my biggest worry. So I think the person I first told was my sister Mariam. I picked up the phone to her because I had to tell someone, and I broke the news to her, and then I thought it was best not to beat around the bush, so I was quite upfront with my family. They were very supportive. I think I'm very blessed, alhamdulillah, to come from a family who are very, very strong. No one really had a breakdown, or no one kind of reacted in a bad way. Everyone was like, "It's okay." Everyone was quite
We'll get through this.
We'll get through this. We're going to do this together. And we did, because my family stuck by me, and, my community, my friends. And I was so lucky, because I was never alone. I was never that patient in a bed, sat by myself. I always had someone by my side.
Were you married then? Or?
I'd had my engagement, so I was engaged. Okay. It was several months after my engagement.
Okay, so you were already engaged.
I was already engaged, yes. So I think
And telling me your fiance, how was that?
He was incredible. So my fiance was living in Kuwait. He was born in Kuwait and he was living in Kuwait, and he was doing great in his work career. And I think our long-term plan was for us to go to Kuwait once I'd kind of finished my training. But when he found out about my diagnosis, he was, alhamdulillah, he was incredible. He just handed in his notice to his work and he just flew to the UK, and that's it. He was like, I'm not going back until you're better. And he did. That
must have been a great support to have him, and the fact that he left everything and said.
I felt guilty because I felt he was leaving behind his career, something he'd built himself and been doing for quite a while, and I felt bad. But this is what he wanted to do, and if anything, we'd not known each other for too long. So actually, if anything, it proved to me his character, and actually, I think it definitely brought us much closer.
Alhamdulillah. I'm sure there are when you go through a journey like this, whether it's a week, a year, 2 years, or however many years it is, there's a lot of lessons that you can take from such a journey. And what do you think the lessons that you took through this journey are?
I think firstly, most importantly, which is why I called my blog Listen to Your Body, is actually tell myself to listen to myself and to be aware of my body, and actually when something's not right, to not to get over anxious, because there's two extremes. You can either be a person who's kind of super anxious and
blood test every week,
exactly, doctor, I think I'm dying, or you can be someone who was like, right, I could be bleeding to death and I'd still be like, oh, it's fine, I just had a paper cut. So I think it's getting that balance and being aware. So that's the number one thing. But I think I learned a lot as a doctor. I learned what it's like to be a patient, and unless you're a patient, I feel empathy is something which no university can teach.
That's very interesting.
No books can teach you how to be empathetic. But when you're on the other side and you are that patient having needles stuck in you left, right and centre, when you're the person being given bad news, when you're the person being given a whole bag full of medications and the doctor's telling you why you're not taking your medications, and all the things that we easily do as a doctor, you can easily do and not understand patients and not understand their perspective on things. So it definitely gave me empathy. I feel I will never ever practice. The way I practice now will always be different.
Okay.
I now feel like whenever I'm seeing a patient, I see myself through them, and I feel like, well, if this was me, what would I want? And I think if a message I had to give out to my colleagues, any of the doctors out there, it's we may think we're empathetic, but really sometimes it's just a front that we put on, and actually it's trying to, if this was our mother, our brother, our sister, our loved ones, what would we want for them? And that's how I now practice.
Amazing. A lot of people were following the blog. I was one of those that read the blog, always looking for latest updates. Why did you do the blog? When did you start, and what were you trying to get? Did it make you feel better, or were you trying to get others to take advice or get some lessons from your journey?
So the idea of the blog, actually one of my friends suggested it. She said, oh, why don't you do a blog? And the day I started the blog was the day I was formally given my diagnosis. So I went home. I remember I'd went home and I hadn't even taken off my hijab, and I was still in my clothes, which I'd gone to see the doctor, and I'd been given that your biopsy has shown it's definitely cancer. And I opened my iPad. I don't have a laptop. I use iPads. So I opened my iPad and I do everything. I love my iPad, and I opened on my iPad, and at that point I wrote down and I said, you know what, I'm going to share my journey. I'm going to be very open. I did not expect to get, I didn't expect people to read it, but I thought I'm going to put it out there. I want to, as a doctor, I felt like I had a duty to be open in a community where people might not be talking about things like illnesses. Yeah. And I felt like why am I a doctor if I am ashamed, or if I want to hide my illness? Actually, no, I'm going to go out there, I'm going to write openly, I want to share with people the ins and outs, the truths, and take people on a journey with me. I didn't know how long the journey would be. I didn't know whether I would continue writing, but I knew when I did start the blog that I wanted to raise awareness. I wanted to be open, and hopefully and it did help me. I think writing was my way of, I didn't want to overload my close ones, my friends, my family, my husband, and kind of let out my emotions to them. And I found it easier to write it all down. So what I wrote on my blog was, all the emotions I put out on my blog were the ones I never kind of vocalized them. So if I had to express myself, it was purely through writing. So it was therapeutic.
It must have been, and it's very different because we're from the same sort of community. Yes. I feel, usually some may hide the illness. Some don't even like to speak about it. Even like, for example, the word cancer in Arabic is never used. The word saratan is never used. No one says this person has saratan, cancer. They use, he has the marad.
Yeah.
That's how I see it. Where we try to not let people know. And so what you were doing is very unorthodox from the community that you come from, but I think it removed that misconception of hiding or not telling people, or so that was very unique. And that brings me to my next question is, from your experience, it seems that you were inspired to give back. Why is that?
So yes, I felt I was very lucky. I had difficult times in my journey. I was really ill at times. I thought I wouldn't pull through because the outcome, things were just not going the right way, particularly when my cancer came back. But when I did,
I want to ask about that actually. So, because you explained the story up until you got the news. So the cancer went and then it came back.
So I had treatment.
Sorry, I interrupted. We'll go back to the...
No, I think it's an important point to touch on because I had treatment. I had chemotherapy. I completed the chemotherapy. I had loads of side effects. So actually my journey with chemotherapy was definitely not a smooth one. When I finally did complete chemotherapy on the 11th of January 2017, I was given the all clear. So my scan came back showing no evidence of cancer at all. And that's when I rejoiced and I kind of announced it on my blog and celebrations began. And that's when I began to plan for my wedding for the second time, because I think I've touched a bit on it. I had to kind of cancel my wedding about 3 times by the end of it. So I was planning for my wedding and things just looked great. I'd beaten cancer, I'd had all the chemotherapy, I'd pulled through. And then about 2 months after being given that good news, I started breaking out in a really itchy, intense rash. And was starting to have some pain swallowing. And I remember I spoke to my doctors about that. And because of my scan results, I felt no one really thought this could be bad news. And I remember the first doctor I saw said, "Oh, let's just repeat your blood tests and I'll see you in a few months' time." But I felt uncomfortable with that because I was listening to my body then. Okay, so the message that I was giving out, I began to take it myself, and I felt something was not right. So I remember going down on a separate date down to the clinic. I didn't have an appointment, but I went down and I saw like the head of the clinic, one of the doctors, the consultants, another one, and I said, "Listen, these are my symptoms. I'm worried." And then he said, "Okay, fine. I'm not worried. It's very uncommon. How you're presenting is not the way that your disease would present. So with an itchy, it was urticaria, so hives, isn't a typical way. But because you've got some pain swallowing, there's no harm. Let's just do a scan." And in the meantime, I was sent to see an ENT specialist to see whether my pains with swallowing had to do with ENT, so ear, nose and throat, and I was also sent to a dermatologist to try and explain the rash. And then I got the scan result back. That was a shock. So I think because I'd felt such a positive, I felt that the doctors were so positive and about it not being a cancer, even though my body was telling me something wasn't right. So when I was told that, your cancer's back and it's a bit worse than what it was, I felt at that point I probably wasn't as strong as I was first time round, because I felt, just those words, I felt like my life had just fallen in front of me again. And it took a lot. I think it was the fact that I had to cancel my wedding again, and I'd put so much effort into planning it, and I'd gone back to work. So I'd just gone back to work, and I felt like I just found my feet, and I just felt,
and then you have to start
the
over
rug
again.
was pulled from under my feet. So that was hard. It took me a bit longer to pick myself up from that, but then eventually I did, and kind of gave myself a bit of a talking.
Alhamdulillah. What advice would you give for people that are going through something similar to what you are going through? And what advice would you give those around them, their loved ones, their family members?
So I would for anyone who's going through a similar journey, I'd say that it's okay not to be okay. It's okay to have low moments, or it's okay, we hear you. You have pain. You're suffering. We hear that. You are not alone. But at the same time, it's really important to remain positive, to find an inner strength, because actually, you can really help yourself a lot. You can get the support of the world, but if inside you, if you don't want it, then it's difficult. However much everyone does something for you, you have to want to fight. And I'd say just don't give up. Be positive, and whatever the outcome is, as you put in what you have, and you remain positive, and you'll get through. And if you don't, it's okay, because not everyone does get through it. But definitely having a positive outlook and acceptance, because I think a lot of people try not to accept.
Yeah, they try to reject the whole
Absolutely.
idea. And seeing the support that you got, and you said that was quite vital from your family and your loved ones. What if someone has from that experience, someone has a loved person going through that? What's the best thing they could do? How could they sort of make the other person feel better, I guess?
Definitely don't play it down.
Okay.
Because actually, when you're not well, you're not well, and so not to play it down, but to be by their side, to be encouraging, to give them space when they need space, but not to completely pull away, and actually to just be by their side, because actually it will, even if they don't thank you, even if they're just too unwell to acknowledge you, they are happy, they need you, and actually your support is really vital.
Do you think again, this is going back to the blog, it was a way for you maybe to express yourself better? Maybe you said not so much with your family, this was your best way, which was writing. Should people try that? Should they try something different to what they're usually doing, maybe if they're going through that? Obviously everyone's different how they take it, but do you think this blog was part of the treatment?
I think it had a big part to play, definitely. But everyone should find what's right for them. And actually, if writing, or if some people find it difficult to be open, and actually, yes, I was open, and I think it's great to be open, but I don't want to put anyone under that pressure to feel that they have to go out and be as open. But find what's right for you, whether it's writing or whether it's even having a bit of therapy. I had therapy towards the end of my treatment when things weren't good, and if you need help or support, if it's not from friends, from family, if you're not writing, therapy is one option, or doing something that you enjoy. So I remember I knitted as well. I kept myself busy doing a few things, teaching myself new skills, a bit of sewing. So I studied as well for exams. So I did everything that I could to distract myself, to keep myself busy. So. And
your spiritual side, how was that affected? Was it something that the fact that you're a Muslim, following the path of the Ahlul Bayt, did that have any help in your treatment?
Oh, massively. I can't begin to explain. My perception on religion changed completely. I felt I went into my illness being one person, and actually, religion is more than the way that you look or the way that you dress. I found I found a connection with God that I think you can really, if I hadn't been through this journey, I wouldn't have found, and that connection was more than a superficial one. It was a trust in God, and actually, I never doubted the existence of God at all, far from it. But I felt God was with me, and I felt that I already felt his existence more than I'd ever felt before. And I think my prayers, I felt when I was praying, it was a dialogue with God rather than it was just a routine. So actually, for me now, religion is even plays a bigger part. My faith plays a bigger part in my day-to-day life now.
Does it make a difference? I'm sure it does actually. But what's the difference between being a patient and being a patient who is a doctor?
Doctors make the worst patients because when you know a lot,
okay,
it doesn't help.
I thought it would help because
it's a two-edged sword, because you can either know too much and then actually you're constantly worrying, or you're over anxious, or it could be good because actually having that understanding, that goes back to what I was saying in the beginning, actually being accepting.
So which one were you, the over anxious or the I think or would it differ a bit? Yeah,
probably a bit. Yeah. So at times when I felt things weren't going right, I obviously I was over anxious, and I never liked to pull out the I'm a doctor card, because not everyone knew I was a doctor in hospital, not all the nurses, but if I felt something was happening in the wrong way, I wasn't scared to speak out, and I don't usually like to pull out that card. So that's when knowing is important.
Going back to one of the questions I asked before I interrupted you, and that was, how has your experience inspired you to give back?
It really has, because I think I went long-winded to try and answer that, but ultimately I was very grateful for everything that the medical team who looked after me did. And I felt that I was very grateful for the support that I got from my community. I did not expect my blog to take off the way it did. I did not expect the messages, the warm wishes. I mean, I can't even begin to explain. It was so disproportionate to anything that I would have ever imagined. And I feel that had such a big part to play in my recovery. And so I felt that when I remember towards the end of my treatment, and I said, if I do get better, because at that point I wasn't responding to treatment. So I told myself, if I do get better, then I want to give back. And actually I want to give back because I'm going to do more to raise awareness. And that's when it clicked me to, at that point is when I thought, well, if I ever do get better, I would love to do something like a YouTube channel or something, just to be able to give back. And obviously not to be charging people or not to replace someone's own doctor, but to be able to raise more awareness, go a step further than just talk about lymphoma, to speak more openly about health problems. And that's why for me, it means a lot. I feel I've been given a second chance, and for a reason, and maybe that reason is to give back, and to keep raising awareness. And yeah.
You've started your YouTube channel, so what's the YouTube channel name? So hopefully we can get people to start following. It's subscribing.
Yeah, please click like and subscribe. I'm learning to say that. It's Milad Hilli, so it's my name, and I will be linking it in my blog soon. What
sort of advice and videos are you going to be doing on the so people look out for?
So they're mainly medical things. So it will be medical topics, like fun facts, talking about medical myths. Also letting people into a bit about the life of a doctor and what it's like and the day-to-day. So everything related to everything medical. Raising awareness is also a big part. Speaking about taboo topics.
Speaking of taboo topics or misconceptions, what are the misconceptions people in our community have towards health-related issues? And did you have situations like that yourself?
Yeah, so I had a lot of support, but there were some people who were a bit negative.
Okay.
So I had comments like, you're lucky your husband stood by you, or or people telling my husband, why are you still with her? And actually, so a lot of comments. So a lot of things like, why would you want to be with someone who's ill? Or so it shows people's ideas of illness and how they see it, and how if you're ill you're suddenly written off, particularly with me, because I've been open about being in the menopause because of the damage that chemotherapy caused. So I think a lot of people feel that once you're ill, then you've got an X on you, or you're less of a person than other people. For example, I know people who are diabetic and being female or male, and people not wanting to marry them or propose to people with illnesses because, it's like a weight you have to carry. And there's this whole thing of people being ashamed of illness, whether they have mental health problems or not. And that's what I really want to get out of my YouTube channel, is that someone who's ill, a lot of the time they're not ill by choice. They're no less of a person because they're ill, and we should be supporting them. And illness does not define a person. I was never cancer, and cancer will never be me. And neither am I menopause. And menopause, I am who I am, and actually my illness is just a part of my journey in my life. And anyone who's got an illness, these are people who actually we should respect, because they're going through their own struggles, particularly people with chronic health conditions. So that is things like diabetes, for example. There are treatable conditions like cancer. Luckily, it was treated. For me, I was treated. But people who continue to suffer with long-term conditions, in my eyes, they are the real heroes. And these are the people who I look up to. And actually, I would tell people, yes, that would be a person you might want to consider to be your spouse, or to turn to them, because these are people who are strong, because they're going through something every single day of their life. And actually, that strength is a positive thing. So, yeah.
A bit shocked to hear that people would write stuff like that. When did you get the news of being all clear? And tell us a bit about was it the third or fourth time you planned your wedding?
Oh God, I've lost count. So I had my transplant. So it was different because you don't have a scan after your transplant. So I've not had a scan since I've had my bone marrow my stem cell transplant. So there was no kind of appointment where you sit with the doctor and you're told, you're all okay now. Mm-hmm. I had the transplant, and then you kind of go home from that. And then it's, the transplant is, in the hospital where I was treated, I wasn't scanned after. So you're assumed to be well. So unless you start developing symptoms. So it was unexpected news, because unless something went detrimentally wrong with the transplant, I kind of knew what I was heading towards.
Yeah. And the wedding?
Gosh, the wedding is a story in itself, because I had began planning it in 2015 when I got engaged, and then I planned to do it in 2016, and then I had to cancel that, and then I planned it again for 2017 and I had to cancel it again, and then eventually I did get married in June 2018. It was great. I kept it very small, very intimate. I still my hair hadn't grown back, so I had to wear a wig. So it wasn't a conventional wedding. It was never, nothing in life is ever perfect. And I think that's what I took away, that you can't have the cake and have your cake and eat it all. So I remember in the wedding, I was still really tired. I had to sit down at times. So I was still gathering my strength. But it was a celebration, and I think it was a celebration rather than of a marriage. It was, cause I think I'd grown so close to my husband because he'd been by my side, that the wedding was more of a celebration of me getting better.
That's great. What other, you've mentioned you read comments like, someone saying, "Oh, why are you with an ill person?" And then you've got, I'm sure you've got the good times. What are the best and the worst things that you faced throughout this journey?
I think the support of people, the openness of people. I think I'd say over 99% of people being so open and supportive about my illness, and that I uplifted them. That was definitely, for me, the best. That I managed to if I did put out a message about one form of cancer or raise awareness. I think the low points for me were my weak point times, when I had my bad days where I wasn't as positive, because you put a pressure on yourself. And I think because people were writing, "Oh, you're so positive," and I ended up putting myself under this pressure to constantly be positive. Yeah. And actually that's not possible, because however resilient you are, and alhamdulillah, I've got a lot of resilience, you're still a human being, and you will break at times, and it's okay to do so. And it's okay to do, because you're only human. You need to give yourself at that time, and that's when I did have a bit of therapy in the hospital. But that they were my low points when I felt that I wasn't being as positive, or I felt let down by myself, but I shouldn't have felt that way, and I learned that through therapy.
Alhamdulillah. Well, the therapy helped, so that's important. Maybe in our community, a lot of people might look at therapy in a maybe negative way, I guess.
Yeah.
And they'd put off people to do therapy because it's not something Iraqis do. But so that's something that, again, you broke boundaries by doing that. Finally, I'd like to ask about the plans for the future. What do you plan? And you spoke about giving back to the community. What do you aim to do?
So I hope to grow my channel, my YouTube channel. I think ultimately that's what I'm really working on. It's something which I probably I've been thinking about back since 2017, and finally I have launched it. I hope to be able to address taboo subjects. I hope to be able to break stigmas and stereotypes, and to help people who are going through medical problems feel a bit better about what they're going through in their journey, and to just continue raising awareness, answer any questions that people have, and make health topics more accessible to people, for people to be more aware and more in tuned with health problems, and not kind of put the blinkers and just ignore what's going on, because it's easy to do that.
Milad Halli, thank you very much for coming on.
Thank you for having me. Thank you.